As a general rule, in terms of surgical principles, it's better to try and minimise your time on an operating table, because the longer you're on the operating table for, the general anaesthetic, the increased risks of chest infections or blood clots and things like that occur. So minimising time is important. Now that has to be balanced with the realities of life, and the realities of life are downtime, financial cost, social costs, all those sorts of things. And so it's not unusual to group procedures together. There's all those reality TV shows of makeovers and all those sorts of things where they're doing lots and lots of procedures on the one person. It takes 8-12 hours. I don't think someone should be having that type of surgery for 8 to 12 hours. I think if you're having 12 hours worth of surgery, it should be because you've got a nasty cancer that you're going to die from, and then it's worth the risk. But if it's a makeover like this, then I don't think it's worth the risk. Having said that, addressing the abdomen and the breasts at the same time is a pretty common thing. The length of time it takes depends on what needs to be done, but on average it's about a 4-hour procedure, 4 or 5 hour procedure, which in my opinion is an acceptable risk if the person's otherwise fit and healthy. And the usual procedures that we're doing is essentially an abdominoplasty or a tummy tuck, where we're removing the excess skin and fat from the tummy, as well as improving the abdominal wall muscles. So we're bringing together the rectus muscles of the tummy to try and improve the core body strength and to reduce the bulge that can occur after pregnancy. And that's normally coupled with a breast procedure, which usually involves a lift at the very least, so a mastopexy, where excess skin's removed, the nipple position's lifted, and it gives the breast a more youthful appearance. So the nipple now sits at or just above the inframammary fold, which is that line where the breast joins onto the chest wall. And it often will improve the projection of the breast as well. So all the breast parenchyma, or the tissue of the breast, is now sitting higher and in a more compact area, and that volume now projects forward. So rather than drooping down or tosing down, it now projects forward. So in some cases, people are keen to improve their volume of the breast tissue as well, and improve their upper pole fullness, and that's when you need to start thinking about the potential for implants. But generally speaking, combining that type of abdominal procedure with that type of breast procedure is doable and is commonplace.